Hello, and thank you for tuning in to the role of DBHDS in Virginia's Commonwealth Emergency Operations Plan. I'm Stephanie Waite, the Disaster Behavioral Health Coordinator for DBHDS. This training is a prerequisite to becoming a deployable member of the Virginia Behavioral Health Medical Reserve Corps Unit. During this brief presentation, you will gain a general understanding of how and when the Department of Behavioral Health and Developmental Services supports the Commonwealth following a disaster or critical incident. The Department of Behavioral Health and Developmental Services, or DBHDS, is the state agency responsible for the administration of public-funded behavioral health, developmental disability, intellectual disability, and substance use recovery healthcare services in Virginia. However, in this video, we will discuss the role of DBHDS during disasters and critical incidents in Virginia. DBHDS is responsible for ensuring that Virginia citizens affected by state and federal declared disasters or emergencies receive behavioral health support in the direct aftermath of the event. The scope and nature of the disaster can vary, but some examples may include weather events in which citizens are evacuated to state-coordinated regional shelters, mass casualty incidents on state property that warrant the service of a state-operated family assistance center, or a more recent example being the COVID-19 pandemic. It's important to note here that because DBHDS does not employ a cadre of responders at the state level, we rely solely on the coordination of local behavioral health support and community services boards. We will talk more about that process in a bit. DBHDS coordinates with the Virginia Department of Emergency Management, the Virginia Department of Health, the Virginia Department of Social Services, as well as other state agencies and local jurisdictions regarding state emergency preparedness, response, and recovery plans. Next, we will briefly review key principles of disaster behavioral health. Key principles of disaster behavioral health. First, disaster behavioral health support services are not clinical services in nature, and they occur in the immediate aftermath of an event. Disaster responses are not predictive of a person's recovery. People are naturally resilient, and most do not require ongoing services or manifest symptoms of mental illness. All disasters or critical incidents are local events, and localities assume the responsibility of initial response. The Public Behavioral Health Agency, or Community Service Board, is the lead coordinating agency for behavioral health support to those affected. Community Services Boards, or CSBs, plan and partner with other local or human service agencies as well as their local emergency manager to ensure that the provision of these services are included in the local emergency operations plan. They also participate in planning activities such as full-scale exercises in the community and are prepared to a variety of critical incidents. Next, let's talk about how DBHDS can support community services boards during disasters or critical incidents. When the resources of the affected community services board wear thin during a response, they can contact DBHDS and request mutual aid coordination assistance. Our goal with this pathway is to ease the burden on both the affected locality and the responding community services boards by serving in a coordination capacity. Some examples of this type of coordination may be contacting the surrounding CSBs with a detailed request for staff to deploy to provide support. The location of deployment is dependent on the event type, but generally includes family assistance centers, state-coordinated regional shelters, memorial events, and other community engagement locations. When the size and scope of an event present a need greater than that of mutual aid, the Virginia Behavioral Health Medical Reserve Corps unit may be deployed to provide behavioral health support to impacted citizens. This unit is trained and coordinated by the DBHDS Disaster Behavioral Health Coordinator. Members of this team are available statewide and are prepared to supplement response efforts of the Coordinating Community Services Board at the local level. Members of this team receive disaster behavioral health training provided by DBHDS and may opt to serve in their local Medical Reserve Corps unit in addition to the state team. Whether outside support comes in the form of mutual aid from a neighboring community services board or the Behavioral Health Medical Reserve Corps unit, affected localities should plan on providing ongoing recovery services with community partners. The next level of support that DBHDS utilizes to support a community in the aftermath of a disaster or critical incident is the CCP program, or the Crisis Counseling Program. This is a short-term disaster relief grant for states, U.S. territories, and federally recognized tribes. CCP grants are awarded after a presidential disaster declaration and is funded by FEMA with technical and programmatic assistance provided by the Substance Abuse and Mental Health Service Administration, or SAMHSA. CCP funding supports community-based outreach, counseling, and other mental health services to survivors of natural and human-caused disasters. As the state administering behavioral health agency, DBHDS can apply as a primary applicant for a statewide disaster or on behalf of a locality that has received a presidential disaster declaration. A recent example of the use of the CC program is Virginia COPES, a warm line developed to support Virginians during the COVID-19 pandemic. The Virginia COPES warm line was operational from June 2020 until November 2021. During this time, over 4,700 warm line calls were received from Virginians. Education and information materials delivered via social media, print, ad, and in-person events, and over 1,000 referrals to ongoing mental health support were provided as well. In summary, while all disasters or critical incidents are local, the Department of Behavioral Health and Developmental Services can be called upon when local community behavioral health resources are overwhelmed. DBHDS has a variety of ways that support those citizens affected by the event. One is by coordinating mutual aid between community services boards when requested by the affected agency. The second method is by deploying the Virginia Behavioral Health MRC unit. This unit is deployed when mutual aid support is unable to meet the needs of the affected community. The team is coordinated by the Disaster Behavioral Health Coordinator at DBHDS using the Virginia Volunteer Health System. And finally, the Crisis Counseling Program may be a method of support when there is a presidential declaration in Virginia. Your work as a member of this unit can truly make a difference in someone's life on what may be their worst day. Access to disaster behavioral health support immediately following a critical incident or disaster can improve both individual and community recovery outcomes and resilience. On behalf of the Virginia Department of Behavioral Health and Developmental Services and the Virginia Department of Health, thank you for your willingness to devote your time and talents to the Virginia Behavioral Health MRC unit. You may contact Stephanie Waite, Unit Coordinator, with any questions you may have about the unit, memberships, and training. Contact information is as follows: stephanie.waite@dbhds.virginia.gov or by phone at 804-516-1778. Thank you for your time and attention.